All right, and it appears that we are live. Good evening, and thank you all for joining us for Davis Parent University's first virtual event. Today's topic is managing stress, anxiety, and parenting during COVID-19, presented by one of our very favorite experts, Dr. Lisa Damour. I'm Pamela Wu. Thanks for joining us today. It really is hard to capture in just a few words how much our world and our communities have changed in the last couple of months thanks to the novel coronavirus. We hope that all of you are staying safe and healthy in these very challenging times. DPU is grateful, of course, to be able to offer this virtual parenting presentation, as we know that one of the groups most dramatically affected by the self-isolation order has indeed been parents. We'd like to start our program by extending a special thank you to Davis Media Access for its tech support and expertise. Davis Media Access is recording this event so that anyone who can't be with us live for this broadcast will be able to watch the webinar on DPU's website, davisparentuniversity.com. This evening's program is going to begin with a 35-ish minute talk by our keynote presenter, followed by about 25 minutes of Q&A with questions that were pre-submitted by our viewers, and then we'll wrap things up around 6 p.m. Tonight's keynote speaker is Dr. Lisa Damour, psychologist and best-selling author recognized by the American Psychological Association for her work on stress and anxiety. Dr. Damour is the author of 2 New York Times best-selling parenting books, Untangled, Guiding Teenage Girls Through the 7 Transitions into Adulthood, and Under Pressure, Confronting the Epidemic of Stress and Anxiety in Girls. Dr. Damour also writes a very popular column on adolescence for the New York Times. She serves as a regular contributor to CBS News, maintains a private practice, and consults and speaks internationally. She is a senior advisor to the Schubert Center for Child Studies at Case Western Reserve University, and is the executive director of Laurel School's Center for Research on Girls. Without further ado, it's my pleasure, my honor, to introduce and welcome back to DPU, Dr. Lisa Damour. Hi.
Hi, thank you so much for having me, and thank you for having me back, even in this strange virtual world in which we now find ourselves. And it's good to see you again, Pam. I so enjoyed getting to know you when I was there before. And I look forward to seeing you again in person or online or somehow in the fall.
Sometime soon, let's hope.
Yes, exactly. Actually, I know I'll be online in the fall, but maybe at a future point we'll be in person. So I am going to talk about what we know in academic psychology about managing stress and managing anxiety, and really what the research tells us about parenting under chronic stress conditions. And so the good news in the midst of all this bad news is that we've actually studied stress, anxiety, and parenting under hard conditions for decades in our field, and really do have some meaningful takeaways for families. So I am going to share a PowerPoint that will just sort of walk us through, and then I'll take it down when we do questions. And the way I have the PowerPoint arranged, all the text is to the left because the boxes typically go down to the right in Zoom, and so there shouldn't be any problem with the text and the boxes crashing into each other. So as I said, we got stuff to say in psychology that hopefully will be feeling useful to families, because I know this is really hard, and it's also really, at this point, very tiresome, and the end is not nearly in sight. So I actually want to start with anxiety. And one of the things that we know in psychology about anxiety, but that is not actually widely understood in the culture, is that anxiety is a normal and healthy emotion. And you don't often hear this description of it, that when people talk about anxiety, they tend to talk about it in terms of like wanting to minimize it or wanting to avoid it or wanting to do anything to keep it at bay. And in psychology, our view is like, no, like anxiety is one of the normal and healthy emotions, and it actually works to keep us safe. And what we mean by that is that anxiety is protective in the same way. I actually think of it as very equivalent to the way the human pain response is protective. That if we touch a burner, the pain of that is unpleasant, gets our attention, and gets us to pull our hand away. Anxiety operates in a similar fashion, that if we are driving and someone swerves and cuts us off, we have an anxiety response. It is uncomfortable, it gets our attention, and it kind of prompts us to move towards safety and to keep an eye on that driver or change lanes or something like that. So by and large, we see anxiety as a normal and healthy function that really serves a useful purpose. If you put it in COVID-19 context, what we can say is everybody's anxiety is higher. Everybody is feeling an elevated rate of anxiety. What I hope for you, everyone who's listening, is that you have times when your anxiety can really quiet down. Maybe when you're home and you're not worried about contamination. But the fact of the matter is, we all have times when our anxiety starts to bubble up. For me, it's when I go to the grocery store. That's one of the few outings we really take. And I get there and I am like a little bit activated. And yet I also see it as a good thing because I'm like watching that shopper and I'm not touching my face and I'm thinking about what I'm touching and not touching. And it's unpleasant. It's a little intense. I'm pretty glad when I'm home, and it's over and behind me, but it's useful for me. That said, anxiety can at times reach levels that we don't consider to be healthy in psychology. One version of that is when anxiety actually is occurring in the absence of anything being wrong. So like, honestly, we don't have that problem a lot right now, but we do, in normal times have that difficulty. But if all is well and there's nothing to worry about, there really should not be a persistent sense of anxiety. And if there is, we're really good at helping people with that. The other form of anxiety that can be unhealthy is anxiety that is way out of proportion to what's wrong. So, you should be a little activated and tense at the grocery store. That's appropriate. You shouldn't be having panic attacks at the grocery store. And we would want to intervene, and we can very effectively if that happens. It is true that under COVID-19, there will be times when our anxiety gets really high. And I think for a lot of us, it's kind of probably coming back around as we venture out into the world a little bit more. And so we know a lot about how to help people really regulate their anxiety effectively. So I want to teach it to you because we kind of need it in a new way. So if you want to regulate your anxiety, the first thing you want to know about it is that it's actually a highly systematic emotion. And this often also comes as a surprise to people, that anxiety feels really erratic. It can feel very out of control. And I think part of that is because it's a very physical experience to become anxious. Our heart rate goes up, our breathing gets quick and shallow. Some people feel queasy, some people feel lightheaded. And that can be really sort of disorganizing for people. But the good news is even this strange visceral experience, which is different from a lot of emotions, happens in a very systematic stepwise fashion. And I'm going to teach you the stepwise fashion so that I can then teach you all of the steps for getting it kind of back in the box. So when we're anxious, like I said, the first thing that occurs is the physical reaction. Heart rate goes up, breathing gets quick and shallow, doesn't feel that good usually. And we don't like it, but there's actually a logic to that reaction that's helpful, I think, to be reminded of. I think most of you know that when you're having that kind of amplified experience, you're having some degree of a fight or flight response. And this is this primitive system that we all still have that was basically put, kind of programmed into us in caveman days, where if we saw a saber-toothed tiger, we had this reaction to either like attack it or run away from it. So we have that same system in play. And the reason that our heart starts to move so quickly and our breathing gets quick and shallow is that our body is trying to send a whole lot of heavily oxygenated blood to our extremities. So it's not a random physical occurrence. There's actually a really powerful reason that if you're going to run away or attack, you need to have, like really oxygenated blood to help you do it. That's why the heart and lungs become so active. That's great, but we're at the grocery store and having this really strong response and really don't need to run or attack. Okay. The next thing that happens is we read these physical symptoms and then we conclude, oh, I must be anxious. And we sort of come to that decision. So you can see already in here, there may be some room to work about whether or not that's the decision we want to come to. And then the last thing that happens is if we become very anxious or we decide that we're anxious, is that then sometimes our anxious thoughts can just take off with us. So we can start to think, oh my gosh, I'm never going to be able to go to the store again and enjoy it. Oh my gosh, this is never going to end. Oh my gosh, this is just really miserable. Like every aspect of life feels terrible. And when we get into those extreme, and we call them kind of catastrophic thoughts, often it actually amplifies the physical reaction and causes it to sort of go into a very unpleasant cycle. Okay, so knowing that those are the steps, Here are the steps for actually intervening. And I'm going to go through this slide quickly, and then I will show, because I'm going to show it to you one by one on these steps. So the first thing we can do is we can actually get the physical reaction to calm down. If that doesn't work or doesn't work well enough, we can reframe the emotion. We don't really have to call this, anxiety. We've got some other options, and I'll tell you what they are. And then the third thing, if we're like, no, it's anxiety, we can make sure our thoughts actually don't become irrational. So for the first step, the thing you want to do is actually to calm the physical reaction, and it's breathing that I highly recommend. Now, I will confess, if we were 3 years ago and I was on the other side of this PowerPoint, this is the part of the talk where I would be rolling my eyes. I'd be like, oh, come on, like really, like the breathing stuff again. You hear people talk about it, they talk about it a lot. And I'm not proud of it, but until 3 years ago, I had sort of a bad attitude about breathing. And whenever somebody would recommend it, I'd be like, I'm a really technical psychologist, like I'm really well trained, like I don't go in for that kind of woo-wee stuff. Okay, so I was wrong. And what taught me I was wrong was actually a very technical paper, which is my favorite kind. And so I encountered it when I was actually doing research for Under Pressure. So before I got to this paper, I did know that it's this very primitive region of the brain back here, right above the neck, the amygdala, that decides that there's something wrong, detects a threat in the environment, as we say, and sends a signal to get the heart and the lungs to start to go, go, go as fast as they can. I knew that. What I did not know until I came across this paper is that our lungs are covered with a network of nerves that are stretch receptors that are constantly monitoring how deeply and slowly we are breathing. And they're there actually for evolutionary purposes. They're there in case we're suffocating. They can send an alarm to the brain. Hey, we're not getting enough oxygen, like freak out now. So I was not aware of this pathway by which the lungs spoke to the brain. I was well aware that the brain had a pathway to the lungs, but I wasn't aware that it was a two-way street. So this, of course, changes everything for me when I understand the underlying biology of something. When we're feeling highly anxious and we want to get our body to calm down, it's really a matter of getting our heart and our lungs to return to normal functioning. Overriding your heart is really hard to do. Overriding your lungs is really straightforward. So when you breathe deeply and slowly, and I'll teach you my favorite way, what you are doing is you are hacking into that network of nerves. And what you're teaching your kid to do, if you're teaching your child to do this, is to hack into the network of nerves on the surface of the lungs, to have those stretch receptors pick up the fact that you are now breathing deeply and slowly, send a message from the lungs up to the brain saying, everything's okay, you can turn off the alarm. So it's powerful stuff. And when I teach kids, I'm going to teach you square breathing, which is what I teach kids. If you go home and teach it to your child, what I would say is tell them the lung story first and say to them, when we do this, I want you to picture the stretch receptors on your lungs, these nerves, picking up the message that your breathing has changed. So square breathing, and some people call it box breathing. Very simple. It just goes like this. So you breathe out all your air, and then you breathe in slowly on a count of 3. 1, 2, 3. You wait for a count of 3. 1, 2, 3. You let the air fall out on a count of 3. 1, 2, 3. And then you hold for another minute, another 3. 1, 2, 3. So that's it. It's very straightforward. What I would say is that if you or your child become very anxious very quickly, or kind of really go 0 to 60 with anxiety, you should practice square breathing when you're calm. So maybe for a couple minutes in the evening, just do a few rounds of it. And the way I want you to think about it, it's almost like a muscle memory, like a groove that you are laying down with square breathing, because it's not that hard, but you do have to concentrate. And then if you become anxious or your child becomes anxious, you can slip into that groove more easily than if you hear it here and then, or you tell your child once and then things become, very anxious to think like, oh wait, what was that thing? Like that's a little bit harder. Okay, so that's the physical piece. Then there's reframing the emotion. So what we call anxiety is really actually just emotional arousal. It's a revved experience. And what we know is that the exact same thing we call anxiety, that kind of activation, is also really useful to a degree in times of performance, like when it's time for your kid to take a test or there's a tryout or a recital. People do their best work when they're not completely relaxed. They actually need to have a sense of caring and tension even around it. So it's not wrong for you to call your anxiety or what you have previously called anxiety something else. So, for example, when I think about going to the grocery store, I mean, I could think to myself, like, oh, here comes a grocery store trip. It always makes me so anxious when I go to the grocery store. But I started to think, like, okay, I am getting in grocery store mode. Like, I'm going to be there. I'm going to be on point. I'm going to SWAT team my way in. I'm going to SWAT team my way out. And like, I'll get home fast. And it really does change how it feels. Because if I'm like, oh, it just makes me so anxious to go to the grocery store, which at some level it does, then I feel sort of like I'm burdened by the challenge of the grocery store. When I feel like, okay, all this juice, all this energy is to help me get it done, it actually makes me feel more empowered in that moment. Okay, so you might be like, no, it's anxiety. Like, we're not calling it anything else. It's straight up anxiety. And I understand that because sometimes we are just very anxious and that happens. Um, the definition of an anxious thought is actually very, very straightforward. So in an anxious thought, we're always doing two things. We are overestimating how much danger we are in, and we are underestimating our ability to manage it. And it's like amazingly simple, when we talk about what's irrationally anxious. To put a pretty fine point on it, I had to work the content of this slide on myself very aggressively in mid-March. I had been at CBS News in Manhattan on March 11th. I had done the morning show, and then I'd stayed in the studios and done a whole bunch of other stuff. And it's in Manhattan. It's this tiny little space. It's all very tight and squashed inside. I'd had hair and makeup done, so I'd had people all over me. And I'd eaten there. I mean, I'd just done all this stuff. And then I found out on March 12th that they had several confirmed cases of COVID-19. And I was like, oh, I was really freaked out. So I come back to Shaker Heights, Ohio, where I live. And I will say, like, I spent the next 10 days, like, taking my temperature a lot, like getting really nervous about every tickle in my throat. And then I finally really, when I was having trouble sleeping, I had to really work the content of this slide on myself. So I was like, okay, just because you're exposed doesn't mean you're going to get it, right? So this is me trying to keep my estimation at a rational level in terms of the dangers. And just because you get it doesn't mean it's going to be bad, right? You could get it and not even have a very bad experience of it. And then in terms of not underestimating my capacities, I was like, okay, you are very fortunate. You have no underlying health concerns if you get it. You actually have a lot of physical resources to bring to bear. Okay, all your friends work at the Cleveland Clinic. Like they will, keep an eye on you. I mean, if it comes to that, like you got the right people in place. And so I was just having to over and over again try to push one down and the other up to keep myself in a good place. And I as far as I know, I didn't pick it up, but it was really a rough pass. And I do feel like we're probably coming back around to more of those feelings, to sort of a more, kind of anxious tension as we do interact more in the world. Okay, let's talk about stress. So the view in psychology on stress is pretty similar to the view on anxiety in terms of seeing it as normal and healthy. And as with anxiety, this puts us really in a different place than everybody else. Also with stress, the culture talks about it like it's an all bad thing. Like, you don't want stress, you want to minimize stress, like do what you can to keep your stress really low. And in psychology, we're like, it doesn't work like that. Stress happens. Stress is often unavoidable. And stress happens around really good stuff, that we don't see stress as negative, as always negative. It's not necessarily attached to bad events. For us, stress happens when you're adapting to anything new. So if you get an exciting new job and you start your new job, like that's a stressful experience. If you move to a cool new city and you're really excited about it, like that's a stressful experience. If you become a parent for the first time, like this group knows, like that's one of the most stressful experiences that ever happens. Wonderful, wanted, terrific, really a lot of adaptation, and that really takes it out of us. So if we think of stress in a COVID-19 framework, this has been a lot of adaptation. And I would say less so now than maybe 8 or 9 weeks ago, when we were really having to figure out how to do everything all at once in a different way. And I think it's hard. I mean, in some ways it feels like a lifetime ago when that was happening, but I was exhausted at the end of each day. And I'm sure you were too. And a lot of that was just constant adaptation. Like, what do we do? And who studies where? And how do we get groceries? And do we have what we need? And I mean, all of that going on so, so fast. Um, the good news is, I think for most of us, we've adapted a bit. We've had time to sort of figure out new rhythms and routines. The bad news is, even though that adaptation has come, probably to a reasonable level, there are ways that stress can reach unhealthy levels, and I think we're probably headed into at least one of them. So one version of stress that psychologists consider to be unhealthy is chronic stress, persistent, difficult conditions. And I think we're either there or we're basically going to get there anytime soon. Like, this is just sort of going on, and it's not what any of us want. The other form of stress, and I'm going to talk about the chronic stress quite a bit. The other form of stress that psychologists don't like is trauma, any overwhelmingly difficult event, anything that really is scary or totally outmatches coping. So it might be something where you're really frightened for your health or safety, or you're really frightened about somebody you love, or maybe even someone you care about dies. That could really be a traumatic event. So I want to pause for a minute on this and just say, if it comes to that, and I really hope it does not come to that, you're going to do a couple things. One thing you're going to do is you're going to get a lot of support around you, and you're going to lean into it. If that's not enough, and it may not be enough, you're going to work with somebody who's a professional in the mental health field. We are really good at treating trauma these days. And you don't have to feel like this is something you have to suffer through and find your way through alone. Important to know, trauma, no trauma, any concern that you've got, you do not need to wait until after things go back to normal to work with someone in the mental health field. Just as your physicians are doing online appointments and like looking at that funny rash online, we are doing online appointments. I am taking care of my patients basically just like this. And so go ahead, if you're worried about yourself, if you're worried about someone in your family or your kid, reach out to a clinician, get a consult. You do not need to wait, and you shouldn't wait. Okay. So stress, in a more general way, is a lot like anxiety in that it's not one big messy thing. It's got facets, and then the more you know about the facets, the more you can actually control and regulate it. So one important form of stress is actually decision-making fatigue. And this is something we know in psychology, is that it is exhausting to make decisions. It takes a lot out of you to choose among things, to have a lot of choices available to you. And I would say that in addition to all that adaptation, or as part of all of that adaptation 8 or 9 weeks ago, part of what we were up against was constant decision-making fatigue. Like, well, how do I do my job? And which kid needs a desk where? And what are we going to do if everybody has to be having lunch here every day? Like, this is not how we usually do it. And when do I get up? And when do I work out? And where do I get my coffee? And all of these things that were patterned into our lives were then lost in terms of the patterns, and we had to come up with those again. The good news is we've probably sorted out some of these, but I want to rest for a minute on this idea of routines. And I know if you were reading at all in the advice literature when all of this started to unfold, people were saying, get new routines, get your kid new routines. And this is true. But I also always felt when I saw that, I'm like, tell them why. Like, there's a really good reason. Don't do it just for the sake of doing it. And the reason is routines reduce decision-making. And that's what a routine is. It's a really good decision set. You have arrived over time, usually, at a routine that turns out to be the best set of decisions for you in a day-to-day way. The best about when to wake up, the best about when to exercise, the best about when and where to get your first cup of coffee. I mean, these are all decided. And the nice thing is you don't decide them again every day. Like, that part of your day is accounted for. And what it means is you have bandwidth for everything else. And that's the problem with decisions, is they just chew up bandwidth. So good for you. You've got some decent routines now on week, whatever, 9 that we are in. Okay, here's the bad news. We're going to keep having to do this over and over again. Kids are going to come out of school. The patterns that we have established over the last 8 or 9 weeks are going to not be so relevant anymore. You're going to have to establish new routines again. Same thing in the fall. And you may have to establish multiple fall routines, because I think we're all really bracing for the reality that school may take different forms at different times in the year or look different on different days of the week. And so establishing new routines is going to be something we have to get really good at. And what I would say is go ahead and put the energy into it. That the more routines you have, the fewer decisions you're making, the more energy you'll have for everything else. Okay, another important form of stress, and this is actually some of my favorite research in stress science, has to do with daily hassles. And the way this research went down is that there was a team of stress researchers, and it was about a decade ago, who asked a really, really clever question. They were like, okay, now wait a minute. When something really awful happens, maybe like a hurricane hits a community, or there's the death of a spouse or something like that, is it the catastrophic event itself, which is what we call those things, that causes people so much stress? Or is it the cascade of daily hassles that are triggered by the catastrophic event that get under people's skin? And so what they did is they looked at a whole community that had faced the same catastrophic event, like a hurricane or something. And they then measured people 6 months after the event, and they quantified how many daily hassles they had dealt with between those 2 points in time. And what they found was, if you want to know what the kind of shape they're in at 6 months, it's how many daily hassles they've had to deal with between the event and the 6-month mark. The more daily hassles people have, the worse shape they're in. And if you think about it, like, no stressor distributes itself evenly across a community. So it may be the same event, but for some people, they don't have good wireless. And for some people, they don't have good access to a grocery store. Or for some people, they have a small child at home, and now they're trying to work with a small child at home under COVID-19 conditions. So it's really important to respect the power of daily hassles in our stress equation. And all of us are dealing with daily hassles as a result of this. Sometimes it's technology, sometimes it's the kid who takes the short nap, which is a problem now because we're trying to get work done. Sometimes it's something like not being able to get eggs at the grocery store. Like, that didn't used to be a thing that I was worried about. And now, calculating how many eggs do I need and how many should I take? And is it okay to take 18 when I usually don't take 18? I mean, these are not the kind of hassles I was dealing with in February. I appreciate my daily hassles are minuscule compared to the daily hassles, if not catastrophic levels of daily hassles that some families are contending with. But when we look at the research, these are the things that really add up for people. So here's what I want you to do. Number one, don't beat yourself up if you're getting upset about daily hassles. Go ahead and take them seriously. And I think that can be a real hazard with daily hassles, where people are like, oh man, why am I getting so upset about the eggs? Like, we have so much food. Like, think about the families that have no food, right? And yes, think about the families that have no food, but also hassles matter. They really do matter. And then, to the degree that you can, like, put energy into taking care of these. Like, they're not small things. Even though one by one they may be small, they really do add up into a concerning volume. Okay, let's talk about parenting. There's going to be 2 things I want you to remember from tonight, and this is the first one. Kids are resilient, full stop. Kids really are flexible. I do not spend a lot of time worrying that this is going to change the developmental course of a child's life to go through this. There are a lot of things we can do, and I'm going to talk us through to prevent that. Kids are flexible, development is long, development is self-correcting, even when it isn't going exactly as we want it to go. I hope you're not worrying too much that this is going to alter the course of your child's life. I really don't think it is. That said, we want to focus on buffering chronic stress. That is what we're into. That's what our kids are going to be facing, if not already. And here, there's actually some very, very good news. So, as I mentioned at the beginning, we've spent a long time in psychology studying kids under chronic stress conditions. And unfortunately, they're really easy to find. We can look at kids who are dealing with intense poverty for the duration of a childhood, or ongoing maltreatment. I mean, like, really awful stuff. And what we've done in looking at kids under these conditions is to really try to understand, what protects them, what exacerbates situations, like just to understand the dynamics and the mechanics of their lives. And in studying these kids, we always come across kids who seem to be in pretty good shape, if not actually seem to have thrived, which seems totally surprising in light of their circumstances. And so, of course, for us in psychology, we're like, okay, like what's the story there, right? Because this kid has no right to be in the kind of good shape they're in. And we have figured out what are the factors that matter. And in one of the very rare poetic phrases in psychology, there's this researcher named Anne Maston, and what she said is, okay, these kids who are in good shape against all odds, they turn out to be the beneficiaries of what she called ordinary magic. And what she meant are protective processes that families can make happen in their home that effectively buffer chronic stress. So I'm going to walk you through 4 forms of ordinary magic that all of you can do and that we know from the research are tremendously effective. So the first one is to give kids a sense of control, to help them feel like there's some corner of the world that they got say about. I think we all need this. When everything feels so chaotic and so uncertain, we all need to feel like, well, there's something here that I'm the boss of and that I feel goes the way I want it to go. So you'll do this in part by having routines and helping them have routines. Like it always comes back to routines. And when you have routines and your kids have routines, what it means is they know when they're off and when they're on. They know what they can work with in terms of free time or busy time. When kids don't know what's happening, they end up kind of being paralyzed all the time. How elaborate your routines are, how rigid your routines are, really varies family to family, and that's fine. In my family, I've got a 9-year-old and a 16-year-old daughter. We all kind of carry on our own routines through the day pretty effectively. Mine changes a fair bit, probably more than most. One thing that's happened, which we didn't try to make happen, is that dinner always seems to happen at 6. Like whatever else is going on, like that somehow has become a pretty fixed point for us. And I think even that degree of certainty is very helpful to my girls in terms of like when to snack or what to expect or how's the evening going to unfold or when's the evening starting, things like that. Beyond that, you're going to give them as much independence as you can. This is true for little kids, but it's especially true for your tweens and teens. There is nothing in adolescence that is well suited to COVID-19. They do not belong at home all day with us every day. I feel like all these poor teenagers have essentially been grounded and they did nothing wrong. You know, I mean, this is how we punish kids. And so it's really hard and really unfair. Some kids are fine with it. Some kids like being home. Some kids don't mind it too much, but most kids really miss their friends and really miss their freedom. With little kids, you can offer independence in terms of not being rigid about things that maybe under other conditions you would be. A very personal example, my younger daughter wears pajama pants pretty much all the time now, right? Like, I mean, just like all day. And I will say the other day, I saw her around noon and I was like, wait, are you still wearing your pajama top? And she was like, mm-hmm. You know, and she'd been doing online school in her pajama top all day. And I was like, oh, well, I just thought like, she's happy, no harm, no foul, right? So those kinds of independence can matter. And then with teenagers, what I would say is give them time when they're off the clock, when you are not intruding on them and they know it. Under normal conditions, we would not actually know what tweens and teenagers were doing, or even elementary school kids were doing from 8 to 3. Like we would have no idea, nor should we know. And so, especially if you feel like there's a fair bit of friction with your teenager, you might say, 8 to 3 on a normal day, I would have no idea what you were up to. So 8 to 3, I'll just stay out of your hair. You know, like you manage your business and I'll stay out of your business. But, you know, I can bother you before 8 in the morning. I'll bother you after 3 p.m. But like the rest of the time, like I'll just let you do your thing. And that can be very fair. Okay, second form of ordinary magic is you're going to help kids have meaningful activity. It really matters that kids do things that they can feel good about. When we think about where self-esteem comes from, and this is really about self-esteem maintenance, self-esteem is feeling good about the things you do well. Like there's no other source. Like somebody telling you you're great doesn't really count for much. You have to feel that you've done something that's useful or meaningful. So right now, a lot of how kids are going to be doing meaningful things is actually just getting their work done for school, which is very like, I know motivation's low and we can talk about that more if you'd like. So they may need a lot of encouragement to get it done. I would say when the summer comes, right? I think it's also important that kids feel like they can point to something they did during the day, whether it was helping out around the house or working on a new project or learning something new or doing some reading. Um, Beyond that, they should also be doing purposeful activities. They should be helping around the house more, and kids of all ages can help more. They should be helping in the community in ways that are safe and appropriate. And not only is this the right thing to do, but we really have this body of literature that shows this helps kids feel good. It helps them get through chronic stress conditions. Okay, the third form of ordinary magic that you're going to make is you're going to have fun with your kid. Like you're just going to enjoy them. And that's why we have kids, because they're fun, right? And so like this is your big chance, like go have fun with your kid. Often it means playing, and often it means playing what they want to play, right? So it may be that you're playing, their board game, or you're playing video games with them because they want you to. It may be that you're doing puzzles. It may be that you're going on family bike rides. But go out of your way to enjoy your kids. It's good for you, it's good for them, and highly, highly protective in terms of them getting through this. I read a lot of the, kind of what's out there about parenting through this moment. And a lot of it, I'm like, that's interesting, or not that revelatory to me. But I saw something that really stayed with me, which is, when kids look back on this experience, the thing they're probably going to remember most is what it felt like in their home. And that to me was really like, that made a real impression. Like, this could be a pretty tense and testy time, or we could actually just say, it is what it is. Like, we're stuck together. Why don't we go play? Like we can really play it either way. And that really inspired me to be more diligent about trying to make it an experience that their feeling memory of it would be a positive one. Another thing to do along these lines is to respond really well when kids have meltdowns. And my sense right now is that we are into the high meltdown season. Everybody's tired of this. Kids are tired of this. And worn thin, and here comes the bad news about the summer, right? If it hasn't happened, it's happening, right? Cancellation of plans, trips, camps, all of this. I think kids know what's coming. I still think it's going to be really crummy when it lands. I have a longstanding preoccupation with meltdowns. I think it's a really kind of ground zero moment between parent and child in terms of how things go in a child's emotional life. And so actually this past fall, I'm going to show you something that'll get shared with you by email, but I'm going to talk you through it. This past fall, I made this bookmark called How to Manage a Meltdown. And it's 9 easy steps. And the most important instruction is on the bookmark. It's not on my slide, which is basically pause between each step to see if it worked. If not, then you can move on to the next step. So I know that this is going to reach you by email from the DPU group. So I'm going to go through it, but you don't have to take notes. You can get it. And if somehow it gets lost in the shuffle, it's a PDF on my website, like on the like one of the last pages of my website. So it's easy to find. But here is the instruction. So again, remembering you pause between each step. So the first thing you do, and this also works for life partners and employees. So this is a good all-around rubric to have. If someone's having a meltdown, first thing you do is you listen without interrupting. This is really hard for us to do, and we almost never do it. But you are going to listen without interrupting, and you are going to listen so intently that you could say back to them a summary of what they said in maybe 8 or 9 words. That is hard and a really good thing to practice. Usually what we're doing, instead of listening without interrupting, is coming up with solutions that we fire off as soon as the person stops talking, which really makes people frustrated. Really well-meaning on our part, almost never necessary. I'll get to solutions. You'll be surprised how far they are down the list. Listening without interrupting, that is often enough. And if the person who melted down on you feels better having been heard fully, you are done. If you feel like, oh, I just need to put a little more in there, you can offer empathy. You can say, I am so sorry about camp, or it totally stinks. I mean, yeah, we've been looking forward to this for a really long time. You are usually done now. If you're still going, maybe like 10% of the time you'll still be going, you can validate distress. You can say, you know what, anyone in your shoes would be upset right now. Like, it's been such a crummy spring, and there goes the fun thing that we were looking forward to this summer. That's all you have to do. Okay, you're almost always done, but if you're somehow rarely in the 5% that's still going, you can support positive coping. You can say, is there anything I can do that won't make this worse? Or do you want some tea? Or do you want to go outside and play a little? Or something like that. Like, okay, you feel crummy, we're acknowledging it, I'm not fighting you on that. Is there anything that would boost your mood a little bit? If you're still going, again, you're probably not, if you've really given this, a good chance. You can say something kind of non-dismissive, confident style. You can say something like, this is tough. This is a really tough thing. And you're tough. And like, I know you're going to get through it, but it's not that fun. Something along those lines. Okay. If that doesn't work, now you can get into problem solving, but you cannot offer solutions. You have to say, do you want my help trying to sort this through? If they say yes, now you get into categories. So you divide the problem into 2 categories: things you can do something about, things you can do nothing about. So in the things you can do something about, the kid might say, I cannot have another peanut butter and jelly sandwich for lunch. You're like, okay, that, number 8, we got lots of options here, right? We can find lots of stuff for you to have for lunch. The other category, they may say things like, I'm never getting this camp summer back. Like, I only have so many summers I was going to camp, and there's one gone. True. So then we get into the last of this, which is supporting acceptance of what cannot be changed. And we say, I know, buddy, I am so sorry. That is a tough pill to swallow. And sometimes we just have to swallow tough pills. Again, a lot of it's going to be you modeling that this is bearable will help kids find it bearable. The good news is you almost never get to 9. Like, if you do the first steps right, you very rarely get this far. But if you get that far, you get that far. Okay, this is the 4th form of ordinary magic, using positive coping strategies. So I'm going to get into detail about what these are, but the overarching view here is you're going to use positive coping strategies so that you can be the parent you want to be. This is you taking good care of yourself, and you're going to help your kids use positive coping strategies because this is how everybody's going to get through this. When I think about what this is going to look like when we come out the back end, it is entirely going to ride on the coping strategies people chose. So here's what I mean. When the going gets tough, we all get coping. I mean, we are all coping all the time right now. That is what we are doing. You're coping by being here. I'm in part coping by giving the presentation. Like, we are coping all the time. But not all coping is created equal. There are negative coping strategies, and they are coping insofar as they do help you feel better. They are negative insofar as they don't work well over time. So maybe it's cutting people off so they don't have to talk to you about feelings because you don't want to talk about feelings. Okay, yes, short term you'll feel better, long term this won't work. It may be turning to substances to manage distress, like a glass of wine every once in a while, no big deal. Using substances constantly to manage emotional discomfort doesn't go well, but problem is, works really well in the short term, which is why it's so easy for people to fall into this. Junk habits is what I call them. Things like taking a phone to bed and just scrolling, or, eating only comfort foods or things like that, or taking it out on others when you're cranky, right? Or your kid taking it out on others when they're cranky. Here's the flip of this: positive coping strategies. So instead of emotional withdrawal, we're going to do social connection, maintain ties that work for us to help us feel good. When you need to take the edge off, which you will, you're going to find a happy distraction. And this is what we know from chronic stress situations. They have to have times where you just don't think about it. So absorbing television, like, this is why Tiger King has had its moment, right? Because you can't think about anything else when you're watching Tiger King. A great book, going out in nature, whatever, just even doing your work often, our kids doing their work takes their mind away from it. Taking great care of ourselves, sleeping well, eating well, being physically active, and then being really, really good to other people. It's good for them, and it turns out to be very good for us. So when I said there were sort of 2 points, one was your kids are resilient. The other is positive coping, positive coping, positive coping. Like, if you remember nothing from tonight, kids are resilient, and focus on positive coping strategies. So I will turn it over to Pam, and we'll do some questions.
And I will unmute myself. I took so many notes.
Oh, good.
Thank
Oh,
you so
good.
much. This is so, so incredibly timely. I love the part about decision fatigue because I think so many of us have been feeling that. I go through a lot of decision fatigue at work. And then when my husband is like, what do you feel like having for dinner? I mean, instead of responding enthusiastically, I don't even have the words.
Yeah.
I don't have a brain cell to dedicate to that.
You're just like, please, like, just, I will eat
I don't
anything.
care.
Yeah, just like, just don't make me have to think it through.
Exactly,
Yeah.
exactly.
Yeah.
I think that this is, like I said, so timely and so helpful. And we have a lot of really great questions that I have all
Okay.
marked up here so that we can dig a little bit deeper. You talked about how this is really a period of great transition for everyone because, well, not only are so many of us dealing with the self isolation and trying to teach our children at home with distance learning, but the academic school year is
Mhm.
about to end. And so this question refers to your recent excellent New York Times webinar, and it says that in your recent excellent New York
Thank
Times
you.
webinar, you spoke of the importance of routine when navigating COVID with teens. And now, with summer on the horizon and minimal opportunities for summer jobs, volunteer positions, outings, creating a schedule seems even harder. So, can you please speak to navigating routines during the summer months?
Yeah, and I'll sort of think about it from the teen perspective, though I think what I'm saying could actually be sort of expanded to younger kids. Um, so in some ways, and I'm very cautious of being like silver lining, because like basically this stinks and none of us want this. But we're raising a very curated and sort of programmed bunch of kids. And so this is a very unusual interval where suddenly we've got this big blank in their schedules. And I would actually resist the impulse to see if you can schedule it as rigidly as we typically find our summer schedules even to become. But I would put in some buckets or some parameters for teenagers. And I would say something like, okay, here's the deal. Every day you need to help out for a while, whether it's watching your little sibling or working in the yard, or, you need to be working and helping family life move forward. Every day you need to do something really fun that is just pure fun. No benefit, no, you might be growing, but that's not the point. Like just pure enjoyment, like, if pools are available and safe like that, I mean, just fun things. They need to do fun things. And every day, and maybe the weekends that you don't have to do it this way, do something that where you're building a skill. But it could be anything. It could be hacky sack. It could be bread baking. It could be harmonica. It could be, learning Russian literature, right? I mean, like it could be anything. The parent has to let go of what the skill is, especially if it's a teenager. And I also think if there's another bucket, and maybe this overlaps with the skill bucket, it might be something where like you have 2 hours with no technology.
Oh, yes.
And you just have to figure it out. Like I should have been calling it like 1970s summer, like, but like 2 hours a day, So I think that that's actually maybe how we start. So there's, a shape to it, but it's not, scheduled within an inch of its life.
Our next question, and I guess this goes to whether there is a bucket for academics. This question reads, if we feel disappointed by distance learning and we want to add something academic into the summer plan, how do we approach this topic with a teen who will not be interested in the break?
Okay, no, they won't. You are right. Okay, so one way to approach something like this is to say like, okay, I have some negotiables and some non-negotiables. Let's start with the non-negotiables. I think it was kind of a lame end of the year. I don't blame your teachers. That was awful for everybody. They did the best they could, but I really don't want to see you losing ground because of this, virus. So you need to be gaining some ground academically over the course of the summer. That's the non-negotiable. Then you got to get into what your negotiables are. Which subjects, or do they get to choose? How much, how far? Is it daily? Is it a set of things that has to get done by a certain date? And if they cram it all into the last week of that, like that's fine. I mean, like have a lot that you can flex on and be clear about what's not flexible.
Pick your battles.
Pick your battles. And along those lines, for people who are looking for structure around things like this, I mean, Khan Academy is amazing for stuff like this in terms of free resources. And Common Sense Media, whom I adore,
Oh, yeah.
just opened something called Wide Open School, which is a fully curated suite of academic and activity resources, and also physical activity resources, and a printable schedule. It's all free, it's all smart. So, if you're thinking like, we got to be doing something useful here, you do not have to start from scratch. I would go to those resources that are available.
That was Khan Academy, and then Common Sense Media's.
It's called wideopenschool.org.
Okay.
Spelled just like it sounds.
Okay, fantastic. When we first started this self-isolation, there were jokes among my introvert friends that, oh my gosh, I was built for this. And so we have a question now regarding introverted kids. This question reads, I'm the parent of an introverted teen whose social and physical needs were best met through the regular structure of schools and dance classes. And she's not initiating much virtual contact with friends in the current situation and shuts down quickly if we encourage reaching out to a friend. What do you recommend for an introvert who's turning further inward?
Yeah. I don't actually worry that much about introverts. I mean, usually when we know from the research, when they get around other people, they've got perfectly good social skills. And I think there's not a lot of like pithy phrases in psychology that I think are true, but one of my favorites is that extroverts recharge by being with other people and introverts recharge by being alone. So let's bear in mind, not only do you have an introvert under stressful conditions. And so the need to recharge may actually be higher than usual, just because we all are struggling to maintain our energy. When to worry, maybe if you feel like that child has no social contact with age mates, is not texting with them, is not talking to them, has really, walled herself off or himself off. The other thing, though, I would keep an eye out for is I'm watching a lot of kids unplug from their regular social networks, the kind of traffic pattern networks they have of kids they saw at school and kids they were interacting with all the time. And I think part of it is it's so frustrating to sort of downgrade those relationships into a format that feels kind of weak compared to what they're used to. And they're plugging in to other relationships that are not as context dependent, like talking to their cousins or talking to a kid they went to middle school with and who went to a different high school and that they like. So for me, I can see why a kid might bristle if you're like, why don't you call Molly? Because they may be like, you don't get the whole contextual piece. But if they're on the, somehow you get the sense that they're plugged in with some other age mate, it may be a kid they haven't talked to in a long time. That to me is good. That to me makes sense.
What about for an extroverted kid?
They're really struggling.
Right, who's like really missing classmates or friends from the soccer team or whatnot.
Yeah. This is really tough. And the social distancing guidelines I know are so confusing. But the best I understand is they can see their friends. My experience, though, is they must be supervised. That it is not realistic to expect teenagers to be able to maintain 6 feet from each other.
Yeah.
So you can say, if you have a kid who's like, oh, I need to see my friend, say, great, have them over. We will set up chairs 6 feet apart in the backyard. I will watch you guys through the window. You can blame your good behavior on me. Everybody should probably wear masks, right? I mean, like, you come up with what you feel your reading of the rules are in your community, your best understanding of the safest thing to do. So they can socialize. It's just really weird. And then I think that's a challenge.
Yeah. This question reads, after expressing empathy to my 17-year-old son who is struggling with the loss of so many parts of his old life, is it ever appropriate to express weariness with his grumpiness, and to say, okay, enough moping?
It might be sometimes, I mean, there's sometimes that kind of like, all right, buck up, buddy, like, show me what you got. I mean, that can actually be appropriate. And teenagers can welcome it. Teenagers can welcome it at times. So if you feel like it's a possibility, I would maybe try it gently and try it maybe with a lot of humor, wrapped around it. It works sometimes. I'm not proud. Well, actually, I mean, I don't mind. It is what it is. We have a joke in my family. It's a long backstory. But where my daughters and I, and they will say it to me, and sometimes I will say it to them, like after a period of moping, they'll say like, okay, but you are a grown ass woman, like go figure this out. And they say it to me, and it's funny. And sometimes it's actually helpful. So I would probably not express like, I don't think this was in the question, but like, I'm tired of hearing it, but often we are tired of hearing it. I would just say like, all right, buddy, time to buck up. Like, show me what you got.
Right. That's that whole grown ass woman thing, right? I mean, it changes the mood. It's palpable.
Yeah, and it's funny. I mean, it's actually funny. I mean, it's there's a long backstory.
Well,
I will spare you.
maybe we'll save that for October when we see you again. But this actually segues really nicely into our next question. I mean, these sort of moods are contagious, right?
Mhm.
Whether it's humor or stress. And this question reads, how can I prevent my anxiety about this time from influencing or affecting my kids?
Okay, this is interesting. So there is that piece around like put on your own oxygen mask before you're trying to care for others. So if you feel like your anxiety is riding really high, like take good care of yourself, breathe, 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 go outside a lot. I mean, really manage yourself because, of course, like our kids know us better than we know ourselves. And so if we're really tense, they're going to read that and they're going to react, even if they're not even conscious of it. At the same time, one of the things I um, really want us to take this moment to do is to get clear about what constitutes mental health, because this has really gotten off track in our culture. And what I mean is, there has been this slowly growing idea that mental health is when you feel calm and relaxed. And that's the definition of mental health, is that you mostly feel calm and relaxed. And in psychology, we're like, no, 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 no. That's not how it operates. And actually, it's dangerous to think that. Mental health is when you have the right feeling at the right time and then resources for getting yourself through it. Like that's what mental health is. You should be anxious, your kids should be anxious. You should be sad, your kids should be sad. You should be angry and frustrated sometimes, and your kids are going to feel the same thing. That is evidence of all of your excellent mental health. So if you feel anxious, you don't necessarily have to hide that from your child. You might be like, okay, going to the grocery store takes it out of me, right? Because I am on high alert the whole time. Own that. It's normal and healthy. What you're going to model is how you deal, right? And this is our moment as parents to model good coping. So maybe you come home from the grocery store and you're like, all right, I need a drink, right? Not the modeling that you want to be doing. Instead, you say, okay, that really took it out of me. Who's going on a walk around the block with me so I can shake that one off? So it's not the distress that has me concerned. It has parents being frightened of their distress or frightened of their kids' distress or people turning to negative strategies for managing distress. Those are the only things I think, okay, that's where we could go off the rails.
Seems to me that so much of the common thread of what I'm hearing from your presentation, from your answers to these questions, is that we should go a little easier on ourselves. There's no perfect way to manage the self-isolation. We've never had, I don't know what perfection looks like. We've never done this before.
Yeah, no, this is a huge crisis. I mean, like that's the thing. I mean, and sometimes it's really helpful to say that to kids. Like, I mean, I'm 50 years old. I've never seen anything like this in my life. None of us have seen something like that. And to actually give kids a sense like you're not overreacting. This is really crummy. Is important. And then, maybe you made plans that you were going to learn 3 languages. If you're like making no progress, forget it. Like you don't need to learn 3 languages. Like your job is to cope in a lot of positive ways. Try to create some fun at home so the atmosphere in your home is good enough. Make sure your kids don't forget how to read if they already knew how to read. That's winning the pandemic.
Yes, that's a win. I feel like, I mean, it's a win if I've gotten to work and answered some email and gotten food in my kid.
Yes.
Yes.
Yeah. Your kid is fed. You have on pants. That's
yes.
all. Like that's what we're going.
Yes. We are very near the end of our hour, and so I just want to ask you: do you have any final thoughts that you'd like to leave our viewers with this evening?
Oh, that's so lovely. I think the thing I want parents to hear, and this may seem obvious, but it's worth saying, emotional distress does not harm children. Kids can get very upset and it doesn't do damage to them. What really, really matters is how you react when they are upset, and that you react in a way that is not frightened or trying to squelch that experience, but that is containing and patient, gives them room to get upset, have those feelings, and then, if needed, moves them towards positive measures for trying to buffer those feelings a little bit. But I would really not see it as the task here is to keep kids happy through this or to expect them to not become upset through this.
Such great advice. Dr. Lisa Damour, thank you so much.
You're welcome. Thanks for having me.
Absolutely. It's been such a pleasure to share the virtual stage with you. I'd like to also thank all of the parents who joined us tonight. And one more big shout out to Davis Media Access for hosting this virtual event. Looking ahead, DPU is thrilled to share that Dr. Damour is going to be returning virtually on October 19th at 5 o'clock Pacific to share work from her latest New York Times bestseller titled Under Pressure. And we hope that you can join us then as well. Until then, we wish all of you very good health. Stay safe, be well, and thanks for joining us.